Before you find a date, you gotta wait, gotta go vaccinate, get it straight, girl, you look good, want you vax that thing.
It's the new anthem of a hot vax summer. Juvenile released this riff on his 1999 classic, I Remember It Well, encouraging everyone to get that jab. Hopefully it works. But on a serious note, as of now, the vaccination rate has nearly stalled among many demographic groups. And people of color continue to bear the brunt, with Black, Latino, and Indigenous people 3 times more likely than whites to be hospitalized from COVID and twice as likely to die. Here to break down the myths and facts surrounding COVID, our friend, public health physician, Dr. Chris Purnell. Dr. Purnell, I'm so happy to have you here. And of course, as always, I have 8,000 questions, so I'm going to go pretty quickly. The first thing I want to ask about is the booster shot, because Pfizer came out and said, yep, it's time to get that booster. The CDC said, well, slow your roll. We haven't recommended that. I'm curious, as a public health professional, where are you on this?
We're not ready for that. We're not ready for that because we just don't have the data that it's necessary. What is encouraging is that the science is ready if and when we need to be able to do that. I think where we need to be focused in the pharma market and where we need to be focused among public health agencies is how we can expedite full approval of these vaccines that are currently authorized under emergency use authorization. So let's just follow the science and the data, but let's be ready if and when we need to do those boosters.
Okay, so sticking with boosters for a second. If I got the Pfizer vaccine, do you know if I can intermix a booster? So, like, could I go out and get the Moderna booster even though I got the Pfizer vaccine?
This is really interesting, right? So how we make recommendations in public health is really rooted in how research and clinical trials are conducted. Because the clinical trials were conducted where we did not mix pharmaceutical products in the real world setting, we have made recommendations that in the 2-dose series that you stick with the brand of vaccine that you received in your initial vaccination. However, when we start to have the conversation about boosters, since boosters will be designed to be very effective against variants that are circulating in the public, there is the possibility that you could have flexibility. You could receive a booster that is from Pfizer if you had been vaccinated with Moderna, or vice versa.
All right. So you talked about variants. I will tell you, I have done some traveling. I've been out and about like a lot of the rest of the people, tired of being locked up after COVID. And I'm a little nervous being places without my mask. It takes some getting used to. This Delta variant has me very concerned. As long as there are these clusters of people who have not been vaccinated, I mean, can the Delta variant or another variant eventually penetrate the protection we thought we had from the vaccine?
As long as the virus is alive and proliferating, there is the possibility for mutations that could potentially evade the immunity of the vaccines that we have. Look, what we do know is that all of these vaccines that have been authorized are very effective at preventing severe disease, very effective at preventing hospitalization, very effective at preventing a critical care stay or being ventilated, and very effective at preventing death. What we don't know with the same degree of certainty is that they can prevent all asymptomatic infections. And that's the data that we're seeing out of Israel, where you saw breakthrough infections, or that the Pfizer vaccine was perhaps only 64% effective. It still held its ground in being 93% effective at preventing severe disease. So we should still be very, very encouraged, but keep our wits about us, Tiffany. I still wear my mask whenever I am indoors in a public setting. And that's coming from a public health physician, because this variant is doing anything and everything that it can to outsmart what we now know to be true.
Right. The virus is a living thing that's also trying to survive. So the way you explain it makes a lot of sense. I have to ask you, I mean, there are still so many conspiracy theorists out there, and I'm like increasingly disconcerted by some of the people who are sharing these. Big Boy from Outkast just shared a video from an older black woman saying, you know, don't get the vaccine. The second gentleman, Doug Emhoff, was at a barbershop in Chicago, and someone said to him, ain't nothing going to make me take that unless my life is on the line. And you want to scream, your life is on the line. How can we penetrate some of these communities? Because you've got the anti-vaxxer communities, and then you have, some pockets of African Americans because of the long distrustful history with the medical community. What do we have to do at this point?
We have to understand the various factors that implicate or influence human behavior. I'm going to make this very plain. I don't have any tolerance for the anti-vaxxer movement, and I don't have any tolerance for politicians who befriend, who cozy up to, or become allies of that movement. I actually see that as another example of the proliferation of white supremacy, because in particular, they are targeting communities of color, and they are targeting the historical injustices, the atrocities that communities of color have experienced as a way to play on their vulnerabilities. Outside of the anti-vax movement, you have people who have questions, and you have people, unfortunately, who have become susceptible to the conspiracy theories. We continue to walk in compassion. We continue to walk in love, but we continue to be very direct. Wherever misinformation and disinformation exists, we who know the science, we who have been vaccinated, we have to speak up, and we have to be willing to speak up continually, and we have to speak up emphatically, because like you said, Tiffany, lives are on the line. Those who are still dying, those who are still being hospitalized, those who are predominantly still getting sick are overwhelmingly the unvaccinated.